Guys, today follow me as we look up the latest in the field of medical technology and robotic technology. We see how robotics are used to improve the accuracy and precision of doing knee surgery with Dr. Charanjeet. Cheers. Guys, do you know that osteoarthritis is a painful disease? It can affect your ability to walk. And the pain can cause you to have a poor quality of life. But things can be done. You can replace the knee. Let me show you how it's done. Cheers. So in this model here, you can see what we do when we do a knee replacement surgery. We cut the bone, shape the bone, put in the implants and put a plastic in between for it to work together to form this artificial knee joint. So today, in this video, I'm going to show you how our top orthopedic surgeon, Dr. Charanjeet Singh, uses the robot to help him to perform this robotic knee surgery. Cheers. Guys, planning and preparation is very important. So first, when the patient comes to the clinic, the surgeon will always check the patient, do a CT scan of the knees, and these scans are sent to the US for it to be calibrated with a robot before it can be used during surgery. The patient is then assessed whether he is fit for an anesthetic. Cheers. So guys, we have three components of the robotic system. First, you have the control system where the CT scan images are uploaded into. And then we have the camera sensor system which communicates with the robot through infrared technology. And this robot is the one that assists the surgeon in the surgery. So guys, this is the camera sensor system which communicates with the actual robot through infrared technology, same as your remote control TVs at home. And this is the control system, and Angela from Stryker is here. The images, CT scan images which have been sent to the US to build a 3D model of the knee. These images are sent back here, inserted into this control system for it to be used for the planning of the surgeries. And you can see Dr. Chan in the background there supervising the team preparing to start surgery. Planning is very important. As Benjamin Franklin once said, if you fail to plan, you're planning to fail. So you can see the planning going on here now. What's the advantage, Ivy, of the robot?
Precision.
Precision?
Yes.
Meaning?
I mean, it will be a precise cut.
Oh, show me what you mean. What is this green thing?
The green thing is the implant.
This
is the bone. Exact, will be the exact size that one patient has.
How do you know how the exact size? You scan?
This is a CT scan from the patient.
Oh, it's loaded into the robot?
Yes, so
okay.
It will plan accordingly to the patient bone.
Oh, okay. So when you cut it, it's precise?
Yes.
So what is the outcome then?
Then you have precise cut, so you prolong the implant life
in the patient.
Yes.
So what is important is proper planning and discussion with our top surgeon, Dr. Charanjeet, and his assistant, and my assistant. So you can see the team preparing all the sterile equipment. Nurse Salma and Nurse Shafiq. Everything has to be sterile. Everything blue is sterile. You can't touch it unless you're scrubbed up. So guys, because we are operating on the knee today, we don't have to give the patient a full anesthetic. We can actually give an injection in the back called a spinal anesthetic, numb the area below, and the surgeon can operate on the knee. Of course, if you're anxious, you can give the patient a bit of sedation so they feel nice and calm. So let me show you how we do a spinal anesthetic. Cheers. The first thing we do is put an intravenous line in to give some IV drip because the patient has been fasting and there will be some blood loss during the surgery.
Okay, good.
Now I'm preparing to perform the spinal anesthetic. All the drugs are drawn out and there's a cleaning solution called Povidone to clean the skin. Cuci belakang sejuk sikit ah. So you can see Dr. Charanjeet here talking and calming the patient down while I perform the spinal anesthetic. Oh yeah. The next thing we do is we give a small injection of local anesthetic to numb the skin before we put a bigger needle in. Once the skin is numb, we inject our spinal needle into the spinal space and give our local anesthetic injection.
Saya bagi ubat sekarang Okey, kamu mula kebas.
So we are done, and then we spray with some antiseptic spray the back, and within 5 minutes the patient is ready for surgery. So guys, although we've given the patient a spinal anesthetic, we sedated her so you won't hear the sounds of drilling or hitting or knocking. And then we are monitoring the patient's vital signs constantly, so it's a very safe procedure. And then the operating theatre is cold, we give this patient this warm air device, gives warm air to the patient. So everything is nice and comfortable for her. Cheers. Now the nurses are putting stockings on the patient's legs to prevent the formation of blood clots during surgery. These are the various sizes of artificial knee joints all ready to be used, and the surgeon will choose one of these for the patient. So you can see here my nurse Siti Zurani is checking the vital signs. We check the vital signs, make sure the patient is comfortable every 5 minutes. As you all know, sterility is important to prevent infection. So the team here, they are scrubbing up to make sure their hands are clean before surgery. So, Dr. Charanjeet, do you feel that robotic knee replacement has its advantages?
Yeah, it does, because it provides accurate precision. It has less trauma to the soft tissues, and basically it gives advantage of early rehab, less pain, more precision, long-lasting knee replacement.
Okay, cheers. So after scrubbing up, then the surgeon wears the sterile gown and gloves before surgery. To maintain the sterility of the robot, it is draped in a sterile sheet. So you can see staff nurse Shafiq cleaning the knee with povidone solution to kill all the germs. And then a sterile layer of dressing is put on the knee called Ioban.
It's important to drape properly. This is Ioban. So Ioban seals off the tourniquet and the what, so there's no germs can go in. So it's important to have a proper draping. Most of the infection happens when this is not properly sealed and draped. Alright?
We also give the patient antibiotics to prevent infection before the surgery. So guys, you see, the first thing to do is when you open up the knee is to put in these infrared sensors which communicate with the robot when the surgery is being performed. Now you see, after inserting the sensors, Dr. Charanjeet is calibrating the system so the robot can speak to the instruments and the control system.
This part we are registering the data. So it feeds the computer, and then after that, that basically helps us to do accurate cuts, and the computer guides us and gives us the parameters so that we can actually do the cuts according to the thing. So now we're just feeding the data, we're matching the CT scan data with the clinical data with these parameters to the patient's knee with the CT scan which has been done earlier. So basically now once we feed this data to the CT scan data, they will do a comparison and give us the best parameters and the alignment we should be taking.
So the infrared sensors communicate with the camera through infrared technology. So you can see here Dr. Charanjeet is going to cut the bone with the assistance of the robot. So you can see that the robot is assisting Dr. Charanjeet in the surgery. You can see here that Dr. Charanjeet is the main operator here, and the robot is just assisting him to make things more accurate. In order to keep the implants in place, cement is used, which is being mixed now and is put into the knee before it hardens. Now he's putting the implant in the lower bone or the tibia, and then he will knock it into place. Now he's putting the implant into the femur or upper bone and knocking it to place. Finally, he puts in an artificial kneecap or patella to complete the process.
You see, walrus is reduced, extension gap 22-20. He started what? Limb walrus is flexion is 1. I'm very happy with this. And then we go to 90 degrees. You see, we go to 90 degrees. Alright. So 17, 18, 5, 4. Alright, 10 walrus. So this is wunderbar. Alright, this is good. You see, stable. Look here. Look at stable, stable, stable. Alright. So you can go and play badminton and all the tennis, doubles, triples, all you can play. Alright? Very good. Wonderful. Okay, alright.
So guys, the surgery went well. It's robotic technology inculcated with medical technology. Brings you precision, accuracy and the best outcome for the patient. Cheers.